When I was a young respiratory doctor, I actually remember this guy Mike. So he was around about 60 and he was in the hospital and had really severe lung disease. And one day when I was doing the ward round, I could see that he was really angry and upset. So I sat down with him and asked him to tell me how he was feeling. And he told me that he knew he was going to die soon and he didn't want to be in hospital anymore. So I was able to talk to Mike and then to his family and to his GP, and we were able to put a plan in place where Mike actually went home and was able to actually die at home sometime later. So from this experience, I discovered that I was quite adept at starting these conversations and helping patients clarify their values and preferences. It also showed me how valuable these conversations are. Early on in my career, I often saw situations where individuals couldn't communicate their healthcare preferences because of an illness or an accident, and then it was left up to their loved ones to make treatment decisions for them. And how do you make these critical treatment decisions when you don't know what the person would want, when you haven't had a chance to actually have a discussion about it? It's such a horrible situation for a family. We know from research that if people don't talk about these things with their families and doctors, there's a good chance that we won't actually know what the person would want. So advanced care planning is essentially a series of conversations where people think about and discuss what's important to them and how they'd like decisions to be made if they couldn't speak for themselves. As simple as it sounds, a lot of Australians don't really understand how to take the steps to actually have a conversation about advanced care planning. So what you need to do is first you need to think about your values and preferences for care. Then you need to talk to other people about these, so your family, your friends, perhaps your doctors, about what's important to you. You might also like to consider who would make decisions on your behalf if you couldn't make them for yourself. There are a lot of resources available on the Advanced Care Planning Australia website that can help guide you through the process. So do it for yourself and do it for those people in your life that are important to you. Plan for tomorrow and live for today.